morning, Richard. Well, good evening where you are, isn't it?
That's right. That's right. I've been waiting for this all day.
I've only just got up. Right, well, we're going to be seeing you this time next week at Biomechanics Summer School up in Manchester.
We are. We are.
And you're going to be talking about medial tibial stress syndrome. That's one of the topics you will be discussing. Now, in the literature over recent years, there's been quite a bit of debate about the different pathogenesis or the different ideas as to what causes medial tibial stress syndrome. And I just wondered what your opinion is on that.
Well, when we talk about pathogenesis, we're talking about the pathology, and I think the literature is fairly weak with that. There's only like 2 or 3 studies to base it on, but they are consistent. And so I think when we talk about the pathology, I think we're talking about a very localized inflammation of the deep fascia right on the posterior medial tibial crest. And then that can result, that constant traction, in a localized stress reaction. So basically it's a soft tissue and a bone injury. I liken it to plantar fasciitis. That's a very analogous problem in that because of traction, we see plantar fasciitis, and we can also see a stress reaction there of the bone. So I think it's a very similar process as far as the pathology. As far as the pathomechanics of it, as you know, tibial bending, they've attributed it, the current thinking as well, MTSS is due to tibial bending. I think that's short-sighted, and I think it's limited. It's convenient because we know that tibial bending does cause stress fractures, but I think stress fracture and medial tibial stress syndrome are 2 separate animals.
Okay,
and I think it's inappropriate to call them the same thing. And there's lots of reasons we can get into about how it is different, but it's anatomically different, clinically different, and I think there's a big difference there. But as far as the pathogenesis, we did a study in 2007, a cadaveric study, to say, is there tension on the fascia when the tibia is loaded and the muscles are under tension? And the answer was yes. And that's why we did this study. We'll share that at the meeting. It was a very low-level study. It was a cadaveric study. We only had 3 specimens, but it took a lot of work to simulate this mid-stance phase of gait. And when the tibia is loaded and muscle tension is placed, there is traction on the fascia. So it's an issue that needs to be dealt with. So I think it's tibial bending and fascial traction. And that makes sense from a treatment standpoint as well.
Okay, well, I will be giving you a grilling on that next week, so I've got lots of questions about tibial bending.
That's good. That's
good. Enough time today. Also, the final session on the Saturday, we're going to be doing a series of case studies. They're going to be quick-fire case studies where all the speakers will be giving short case studies. Now, this is a session or something like this that you've been involved with in other conferences. How do you think it benefits the delegates by doing a series of quick
Well, I think it benefits the delegates because these case studies are real patients, and each case study has a certain emphasis on either diagnosis or management. And by presenting a case study, a lot is dependent on the moderator to generate and guide the discussion. But the discussion can take off on any topic we want related to this case study. So it generates audience participation. So the audience is not passive. They're not just sitting there watching someone or listening to someone lecture. They're actually, they're going to get involved in the active discussion. And I think it's the perfect foundation for audience participation. We've actually had a few meetings where all we've had is case studies, and the responses from the audience participating is it's excellent forum for education and learning. So I'm really looking forward to that. I know it's kind of a deviation from the normal talking heads format, but I think people are going to find it to be very, very good learning experience.
Yes, and I guess as well it brings it very much down to earth as well, doesn't it? Because a lot of clinicians would have seen those sort of case studies as well.
That's right. Exactly.
Let's hope everybody joins in and asks lots of questions on that session.
Yeah, that's good. Looking forward to it.
And finally, do you have a top tip for treating sports patients?
Well, my big thing right now is I deal with a lot of residents and fellows, and I make an observation that's interesting. With all these new imaging studies we have available to us, we have to get away from dependency on these MRIs, ultrasounds, etc. I think those imaging studies should validate what we already know. So my big emphasis is on physical and historical exam, and especially physical exam. I think it's a lost art. There's a lot of physicians in Seattle
Okay, and finally, Rich, do you have a top tip for us for treating sports patients?
Well, with my sports patients right now, I'm making I'm putting a lot of emphasis on diagnosis based on history, a very succinct history, and then physical exam, which has to be very focused and efficient, and stressing provocative testing. And I'm just amazed at working with some of the residents and fellows that come through my practice that I feel it's a lost art is the physical examination. And we have to get back to that. We cannot rely on diagnostic imaging to make our diagnoses. It should confirm what we already know. So
Absolutely.
provocative testing, no matter what the pathology is, every entity that we see, you can name it, we should know what the provocative tests are and how to perform them properly. And I think that goes a long way to being efficient in the office, especially with sports medicine patients, because they demand the best and they want a diagnosis that's accurate and validated so appropriate treatment can be initiated. And I think that's an important emphasis that I will emphasize in the workshops, because we're going to have a workshop and I probably have 30 or 40 entities. We'll take one at a time, just start going through the list. And what is the provocative test for a specific problem? We need to know it and know how to perform the exam. So I look forward to that.
I look
Thank
forward
you.
to that too. Yes, I think sometimes we rely a little bit too much on modern technology, don't we? And we almost lose the art of doing things manually.
That's true. Yeah,
Yeah.
exactly.
Right, we're running out of time now. Thank you very much for your time this evening, and I look forward to, well, we all look forward to seeing you next week.
And I'll be there. All right.
Hope so.
Yes.
Take care.